Welcome to the Wenatchee Valley Museum and Cultural Center's Social Justice Community Forum series. I'm Ashley Sinner, the museum's Outreach and Public Relations Coordinator. It is the mission of the museum to gather, engage, and educate the community on the history, culture, and diversity of our region. The museum is a place where we can meet with our neighbors, learn about issues important to our community and our world, and discuss our thoughts and opinions. While we're not able to gather physically today, we're eager to serve in this role virtually by gathering in forums like this to inspire engagement and cultivate conversation. So our goal today is to engage in a thoughtful, inclusive, and open-minded discussion about access to transportation in the Wenatchee Valley and its effects on the quality of life in our community. It is my privilege to introduce the panel joining me today. We have Mobility Coordinator for Link Transit, Maggie Kaminoff, Civil Rights Coordinator for Link Transit, Lynn Bourton, Community Engagement and Outreach Specialist at Washington State Department of Commerce, Francis-McWhite, Executive Director of the Chelan-Douglas Transportation Council, Jeff Wilkens, and the Administrator of the North Central Regional Office of Washington Department of Transportation, David Bierschbach. Thanks to our partners, our partnerships with Link Transit, Together for Youth, Molina Healthcare, and Coordinated Care of Washington, live Spanish translation is provided today by Anna Reagan with Claris Languages. If you are logged into Zoom, you have the option of listening to the translated audio channel. You can do this by clicking on the icon of the world and selecting the Spanish option. Before we begin, I want to remind the panelists and myself to speak a little slower than our normal rate to help out our translator. If you're joining us live and have questions for the panel, please submit them through the Zoom Q&As or chats located at the bottom of the screen. If you're on a mobile device, these are available at the top of your screen. If you're on Facebook Live, please submit your questions in the comments. Our staff will do our best to address as many of these questions as we're able to. While we often think of transportation in the context of traffic congestion and pollution, transportation touches many aspects of a person's life. When we consider transportation in the context of social justice, we might think of the bus boycotts during the 1950s and Jim Crow laws and racial segregation, or about the necessity of making public transit ADA compliant. However, when we consider that transportation is the way in which people access goods and services, we see it is necessary for an acceptable quality of life. And in fact, access to transportation is the #1 determinant to employment and community involvement across the country. So my first question for the panel is, why is access to affordable transportation a gauge for healthy communities?
Who would you like to start?
Anyone, just jump in.
Well, I'll jump in. I'm the only one not on mute right now. But so in my position as the mobility coordinator, I do a lot of outreach with the vulnerable populations, seniors, persons with disabilities and developmental disabilities. And access to affordable transportation from my perspective, is critical for people to be able to get to healthcare services. That includes, medical, dental, eye, and that type of thing. So when we see vulnerable people not able to access those essential services, it compromises their health and their well-being, actually. So many of those folks are also low income and unable to drive. So access to affordable transportation is critical to their health care.
And I would follow up with access to jobs, to school, and being able to plot out your path in life. So we see a lot of at Link Transit, a lot of what Maggie's referring to, helping people get to their medical appointments, but also that lifeline to work and even groceries and that sort of thing. So it's all encompassing.
So I would add to that as a, as a gauge of a healthy community, I think it's directly related to a community's economy. It's how people participate in the economy, participate in society. So the more that people can be engaged, be employed, be engaged in society, the less we have some of the other negative problems that we deal with, like the housing issues you talked about in the last session. So yeah, I think it's directly connected to all these things.
Yes, and I'd agree with the previous speakers. And the other thing I would mention, they talked about access to healthcare, but also having active trails out there for active transportation, sidewalks for people to move on. It's just having a healthy living, having transportation out there options so people can be healthy and active, and which can help improve the overall health of the community.
I'm glad you mentioned sidewalks. I didn't ever even think of that in the context of this discussion, but where I live in East Wenatchee, there are no sidewalks. So my kids, I don't let them walk to school because of it, because I don't feel comfortable having them, especially even in like the wintertime and stuff with snow and other things on the narrow, the sides of the roads. But sidewalks, yeah, they're a huge issue. And to me, they're really important, but it didn't even occur to me in this context to even think about that.
Whether you're a kid or somebody who's, an adult who needs to have a job, you think of your transportation options as the bubble you live in. It kind of defines that bubble. If you're a kid and you don't have sidewalks, your bubble's smaller. Or if you're a person who doesn't own a vehicle, doesn't have good access to public transit, your bubble, your range of economic job opportunities, social opportunities, recreation opportunities, it's all a lot smaller.
And I think Maggie could probably better than I address this, but when we look at providing our Link Plus or door-to-door service to our guests who are eligible under the Americans with Disabilities Act, we have to look at their pathway and can they get from their door to where our bus stop is. So again, yeah, it's a huge component.
And we do have a disabled community that frequents public transit who use wheelchairs, electric and manual both. And those people have jobs in the community. So it's not only healthcare, like Jeff was saying, it really contributes to our economy. And those sidewalks, those paths of travel, ramps, even when you're looking some places downtown, you might see a lamppost or a mailbox right in the middle of the sidewalk. So that accessibility really can restrict people in wheelchairs or using walkers or who are compromised in some other way to be able to get to where they need to go. So yeah.
When we talk about quality of life, of course, we talk about healthcare and jobs and things like that. But I think especially this year, we've noticed the social aspect of it too. And if we don't have access to being able to get to where we socialize, whether that's a senior center or a school or a church or, just going downtown, that would change your quality of life too, right?
Well, even all the recreational opportunities that we have in this area. So, just because you might use a wheelchair doesn't mean that you can't, use the Riverwalk or, go out and take advantage of all our recreational opportunities. But if those barriers are there, that's very restricting.
I think you're, Ashley, I think part of what you're speaking to is this larger public health context, right? If we have more diverse, more diverse transportation options, including diverse public transportation, and we're quite lucky in this region to have as robust a network as we do have through Link. That helps improve also the air quality, fewer vehicles on the road, improve air quality, but to your point as well, the fact that transportation means can help us maintain our social lives, that public mental health component is critical. And of course, the economic health. I mean, to Jeff's point, everything is very well integrated in terms of what it takes to create a healthy community. And to David's points about the parks and trails and having non-motorized transportation options. I live in Kashmir, and my goodness, I would love for there to be kind of a safe biking trail that could connect the upper valley to the lower valley. That would become my bucket list item before I could do the STP. Right now, the fact that I have to go 97 to do that means it's not happening.
I don't blame you. We don't have sidewalks to get to the park, but also bike lanes to get to the park. So my kids who the park is so close, maybe would have access to it, don't unless I go with them. A much smaller scale for sure. So what are the options locally for people who can't afford independent transportation? Because obviously if you can't afford independent transportation, we drive our own cars or whatever, but what are our options if we can't, if we aren't economically or otherwise able to have independent transportation?
Well, right now with COVID, Link Transit is fare free. So that has taken that barrier away. However, we're also struck now with having to social distance and limit the number of people we can have on vehicles depending on their size. So yeah, so right now, at least from Link Transit standpoint, free is a pretty good price to pay.
I think the answer to that question depends in large part on where a person lives.
Yeah.
I mean, there's parts of Wenatchee and East Wenatchee that have great access to bus service, great sidewalk networks, maybe bike lanes. And those are all great options for somebody who can't afford a car. But that's certainly not everybody's environment where they live, particularly if they're in a rural area.
So I know that we have Lyft and Uber in the area. So those are options. There's a cost associated with them, certainly.
We have a couple small volunteer chore type transportation services, but then there's limitations to that. There's qualifiers to that, usually people over 65 or persons with disabilities. And we don't have a lot of options besides Link Transit that I'm aware of. Of course, I work with, a demographic here in Wenatchee, but they're on the private.
Explain what's the volunteer.
Oh, I'm sorry. It's just in my head. I need a reader board so people can read what's going on in my brain. Volunteer Catholic Charities is one. They have a volunteer chore service, which is volunteers that provide time to assist seniors in their homes. Well, not in their homes at this time, but yard work, shopping, things like that. And a component of that is to help with transportation, taking people to the grocery store, taking people to church, taking people to their medical appointments. And that is a free service. ENIAT also has, ENIAT Community Services has a similar type program, but it is limited due to criteria for eligibility. So if you're going to be using Uber or private taxi or Lyft, or even there's an Uber type company called GoGo Grandparent that is a part of our system, there still is a cost involved, and it really depends on a person's income to be able to afford those. So I think transportation we have limited. Unless you have your own bike or your own, vehicle, it really is, especially Jeff was saying, in the rural areas, people living up in Waterville, people living in ENIAT, people living, even up as far as, out in Mansfield, there just is not a lot of choice for those people in those communities.
I have a related thought to share on this, which is it's one conversation about households or people who don't own a car and depend on these other services. But it's important to note that for a typical household, transportation is the second highest cost. I think for an average household in America, it's over $800 a month, second only to your rent or your mortgage. So, you think about your conversation about housing, the challenge of housing affordability. Households that are trying to figure out how to cover rent or a mortgage and transportation for 1 or 2 cars, these choices also represent a really good opportunity to maybe have 1 car instead of 2. If you look at the overall sort of affordability of a household budget, it's invaluable for people who don't have that car, but it's also a really good way for households to deal with these cost of living challenges.
Wow, I'm glad you brought that up. I've always learned so much talking to all of you. And I didn't even think to research or look into, how much of your budget goes to transportation, but that is a much larger amount than I even imagined.
Lynn, kind of along the same line, and I'm always having to, I always put my plug in for our travel training program. People that can utilize Link Transit, but have never used the bus system before, we do have a travel training program that we have a trainer that actually works with people to learn how to ride the bus, individuals, one-on-one, or small groups. So, if you're out there listening, there is an opportunity there, and it is free to the community to really be able to utilize public transit as much as possible too. But again, when we're talking about rural areas, that's kind of a different story. We just have this 2 totally different populations, the rural population and then our city or metro populations, and it makes a big difference where you live.
That's true. I guess if you don't have access to anything, then your circle gets smaller and smaller. Your ability to then to move out of that by better job opportunities and other things would then really be limited too. So again, like that housing conversation I recently had, that is a huge barrier for people if they can't kind of increase their, if you can't get there, it seems impossible again to be able to get out of the situation you're in if you have no means to do it, right?
Right. To expand your bubble.
Yeah.
Yeah.
Expand your income, expand your, yeah, gosh. So can anyone share with me what demographics besides obviously more rural areas, who I guess in the demographics in our community face the most barriers to transportation? Is there certain demographics that tend to that we need to be more aware of, that they need us to pay attention to this issue?
I think those people that are mobility challenged, you could be senior, you could be disabled, you could be temporarily disabled, you could be, like your path of travel, so to speak, is not accessible. In my work, we see, and I say we as in the network, my background is in social services, so my network has a tendency to be in that area, and people become isolated. So I think people that are isolated, particularly seniors or persons with disabilities, I think that population faces big barriers, not even be able to get down the stairs or out of the house if their house is not accessible outside their home, and that can create other problems too, is becoming isolated and can lead to mental health and medical problems. But that's my perspective because that's the population that I work with. So,
and I think to Jeff's point, it depends where you live as well. So that demographic of, as you said, Ashley, I can't get in to get the services that are there. So that could encompass a whole lot of different people with a lot of different demographic components.
Mm-hmm.
Yeah, and I mean, we didn't say it directly, I suppose, but income level is probably a you know, the lowest income individuals in the households are probably the ones that have the most challenge with access to good transportation. And another one that I can't really speak with good knowledge about is that we have a pretty substantial population of non-English speaking people in the valley, and they, you know, for that alone, they may have some challenges that we don't understand very well for access to transportation options.
Yes, and I'd really agree with the same item, just to tack on what Jeff had said about the non-English speakers. Is there items or opportunities that they're missing out on because of that? Are we not communicating enough languages out there for them to understand the options and have access to the options? And then dropping back to what Maggie said, I think a real emphasis is on the senior or the disabled population and what we've been talking about. Are they able to get just a block to the bus stop? Can they walk there, or do they not even have a type of facility that's safe to even walk a block? You know, does that prevent a challenge and limit them again in that bubble, get them isolated, which becomes a really unfortunate cycle that people can get in once they get isolated. That can build on itself and continue. So thinking about those populations.
I've been curious what the youth use rates of Link in particular have been, or if there's much data out there about how young people in the region are using the public transportation access. I certainly have memories of my own childhood, but you know, suburban California, where that was my first taste of true independence. Well, second, first was the library card. Second was my bus pass. And I'm curious if we have a comparable sort of transportation culture in the region here.
So it's interesting right now because the schools aren't open, but we do have a large youth population that uses it for many different things. We see a lot of, right across from my office is the tech center, and we see the students come to the tech center on our vehicles. We do a lot of school aged kids riding that. In the summer, we see them riding a lot to the parks and to Chelan, Mission Ridge, that sort of thing. So we do have a large youth population. It's just different right now. Like everything else is different right now. Yeah. But that's a great group to get involved early on in transportation. We have one of our outreach coordinators that works in the schools to educate kids about Link Transit, how to use it. They develop our passes that we've used for years. The kids draw those passes, and we, vote on them here at Link and decide who's the winner. And so we're trying to engage kids at a young age. And it's just that right now, with schools being closed, basically, we're not seeing as many youth riders.
Yeah, and to kind of tag on to that too, from my mobility services office, our travel trainer works with the school transition programs, special education programs, mostly high school, and helping those paraeducators and educators teach kids how to use the system, how to use the regular bus service, how to apply for Link Plus, working with family members. So, I think, and then our outreach coordinator, Selena, who helped facilitate this, also has transit ambassadors that she chooses from junior high up through high school that are part of our outreach to the community and representing Link in that capacity. So we have I think, Link has a really good relationship with the schools. The younger, the better, getting them used to riding that bus. But we, right now, it's very quiet, very quiet.
That was kind of a good lead in to my next question. We talked about how Link's fare is free, and now about how it's changed a bit demographic wise because of COVID. What are other changes that we've seen in our region to transportation because of COVID?
It's been huge, as I'm sure it has for many organizations. First of all, we have had to install plexiglass shields in all of our vehicles to protect both the driver and the guests. We have stopped taking fares because we didn't want that interaction between dollars and people's hands. Masks have been, required for quite a while now. We're all getting used to that. We're providing masks. We are just now able to install a ultraviolet filter that in our vehicles and in our facilities that will, similar to airplanes, be kind of cleansing the air and fighting that virus and flu virus and other things as well. So it's a great, I think, resource for us. But we've had to have social distancing now. The governor's proclamation and things keep changing. So the social distancing requirements have changed, and gotten to be less and less people. We are in the process yesterday and today of blocking off seats in the vehicles. We've had to put more buses on to allow for social distancing in some situations because we may have more people wanting to get on a bus than we can have capacity for. So there have been a lot of changes, and I think the word is pivot, right? We use that a lot this year. We'll continue to pivot as we need to.
We're still providing the paratransit services as well for our disabled and senior populations. The application process is online. The one thing, the big change with that program is we used to do the interviews for qualifying in person, able to sit face to face with somebody, be able to observe how a person moves, their mobility status. Now we're doing them all over the phone, which is it's difficult because you don't get that one-on-one visual with that person. And we've seen those applications because people are isolating, they are staying at home, that segment of the population particularly. So those applications have dwindled significantly over the last month to 2 months. Big change from before.
Early in COVID, back in 2020, May 2020, driving had dropped off a lot around the valley as well, as low as maybe 60% of normal traffic on our busier roads like North Wenatchee Avenue or George Sella Bridge. But that bounced back pretty quickly. By August, we were back to about 90%. So yeah, general travel fell off a little bit. I don't think it was impacted that much. Transit ridership, bus ridership dropped off too. But I think it's really important to be aware that compared to a lot of, perhaps larger cities like Seattle, they've had drastic reductions in bus ridership, down to maybe 20 or 30% of their typical. And that's not the case here. I'm not really sure where we're at, maybe 60%. But the reason for that is our community isn't full of downtown office workers who now have the luxury of working from home compared to a downtown Seattle. The people riding our bus, you define them as the essential worker. They need to be on that bus. Mm-hmm. And so I think this gives us a really good opportunity to be aware of the value, not just for those people who depend on the bus or are taking advantage of it, but the fact that that's really important for our economy in this valley, for our employers too.
So the one thing I'll say about statewide transportation revenues, with the reduction of people driving, especially driving to other places across the state, there's been a drastic reduction in gas tax revenue and also toll collections in Western Washington and the ferry fares there too. So the number is about $500 million less this biennium, which is a huge impact to the state transportation budget. And there's been some decisions made already. We haven't let that affect our winter maintenance work out there. And projects that are preserving the transportation system, such as paving or chip seal projects, or projects that are safety projects. We have some ADA ramps up at Leavenworth that will be doing that, hopefully will not be cut. So those projects are in store, but there's some larger projects, capacity projects around the state that may be cut. There's one on North Wenatchee Avenue that'll provide some good bike, pedestrian and transit facilities, and the same on SR 28 corridor in East Wenatchee. They have not been cut at this time, but they may be delayed, pushed out further on when they will be delivered, just because of that collection of money is not there, and so funding not there. So that is an impact of COVID on the funding of future transportation projects. We'll probably see the effect of that for several years. So I just wanted to point that out if people hadn't thought of that or aware of that.
Yeah, thanks for mentioning that. Yeah, there is just so much when you think about it. It's kind of crazy how you can talk about sidewalks and like $5 million budget that didn't, fines that didn't make it in the same, conversation about transportation. So I imagine with, and maybe Karen, you know more about this, but what about how, because the COVID is such a big healthcare need, and it's just been kind of a crazy thing. How has COVID affected people getting the healthcare they need? Has it been that they didn't get it, or what are the effects there, if any?
Health is not my primary sector, but I have been keeping abreast of, kind of some of just the general news about these various impacts. And it does seem that, that's one of the reasons why so many of our rural hospitals are struggling right now. Their critical revenue comes from some of those optional surgeries or non-emergency surgeries at the very least. And they're not able to do those given the amount of care that's been required for COVID patients and the space that's been required to care for them. And so I think that there are people who are delaying care, who are putting things off. I needed to go to a dentist and I waited a full year just to feel a little bit better, and I know others who have optional surgeries that probably should be taken care of soon, and they're not going to. At first it was out of choice, and now it's out of capacity. The hospital simply can't accommodate them. Maggie?
I can relate to that personally. Yeah. I think that, my light went off, there we go. In working with Megan Parrish, who's at the Confluence Health Foundation, and then even just my personal life, I have a brother that's in a long-term care facility, and I haven't seen him for 7 months, something like that. And so I know he's being cared for, but it makes me wonder about the healthcare too that isn't happening because of the staffing issues, and because of COVID isolation. And we talk about isolation and how that can impact a person's health, not just a person with disability or an elderly person, but someone like me who's waiting for knee surgery, and it has impacted my quality of life. Certainly not nearly as much as some people, but it has an effect, and it kind of has this snowball effect. One thing leads to another, and if it's your brother, then it's you may be a cousin, and maybe another family member, and then your coworkers. So it does impact. I think that I think our healthcare system has been incredible under the stress that they have been in the last months do what they have to do. But it's affecting all of us. Yeah, personally and professionally.
And for people who need to get healthcare, get transportation to healthcare, in an emergency situation, what are their options? Like if they don't have independent transit, if they're rural, if they need to be seen, I suppose maybe their first thought is it's too expensive to call 911 and get an ambulance. What is maybe it's not an emergency to call 911. What do you do in that situation? You really need the healthcare. What are there options for people who maybe just share some resources with us so that people out there listening can know, like, what can I do? And so I don't feel so alone or stuck and not able to get what I need if I don't have my own network.
Well, if you live within the Link Transit service area, there's certainly options there. And I know that we've kind of talked about how, we're talking about the people that are living out, but Link Plus, we're still accepting applications. But that's something that you want to prepare yourself for if it's going to happen, because there's a day reservation involved in that. I think that our ambulance services, I think, are really responsive. I would call them and ask, this is my situation. What should I do? How should I handle it? Do I need to call a neighbor? Do I need to call a cab? Do I need to call 911? I think they've been really compassionately responsive to people in our community, but it's limited. It is very, at least from my perspective, it's very limited. Yeah. This
just brought up an idea for me because of something that happened last summer where we were looking for not in this area, but in with family out of state, it's like a medical cab or a medical transportation, but it's not emergency, it's not an ambulance, it's just a transport system medically. Do we have stuff like that here in our valley?
We do. Again, it's based on certain eligibility criteria. At least the emergency medical transportation that I work with, most people need to be on Medicaid, which is the state service. But that's the only non-emergent transportation that I'm aware of, unless it's a private pay, or you're going to be using, Link Plus or the paratransit service in whoever's community. Most communities that have public transit, well, they should have paratransit. But again, there's those qualifiers and those steps that need to be taken before you can actually use that service. So I just encourage people to, reach out to your neighbors and your friends and say, if this happens, are you available? Would you be available? If, how do I maneuver my wheelchair, if I need help? There's lots of things. I think calling maybe an agency that like Aging and Adult Care in our community to get some ideas of what services are out there available that could help in that capacity. It's just pretty limited right now, because even with volunteer driver programs, they use retired citizens volunteers. So many of those retired citizens are also quarantined, or they're choosing not to go out because of the COVID situation. So, you just kind of have to, hopefully you've got an advocate, you can always call like Aging and Adult Care, which is located in East Wenatchee. You can certainly call me, call Community Action, and I can send you that information as well, just for those resources.
Great. Yes, we'll post any resources that we get from our panel on our website so everyone has access to them. This made me think of you're talking about the resources available for people who qualify. And in my recent conversation about affordable housing, there is kind of temporary assistance programs for people in that sector, but again, they're temporary, so they don't cover like longer term assistance, and so people have to reapply, and so there's a big gap. And then there's also just a demographic that doesn't quite qualify, but also can't quite afford it on their own. And so do we have something like that in transportation too, where there's assistance, but it doesn't quite cover the needs of the people who need assistance?
I don't know the answer to that question, but I did have a thought that's related to medical access and just the general idea of isolation and lack of transportation. I do think I'm optimistic that technology is starting to catch up and help deal with some of these issues. We don't think of broadband as transportation, but in a way it is for a lot of people. Telemedicine is taking hold and expanding. Education, even employment. We'll see what the future brings, but I do think that probably will do a lot to address some of these challenges for at least some people.
Yeah, I agree. We got forced into learning about all of that stuff and to become more comfortable with it, just like today, right? Being on a panel virtually. So there's a lot of opportunities available that way. That's a good point.
And rural broadband investments are kind of critical pieces of, or there's certainly there are priorities within the Department of Commerce, and there's certainly priorities coming out of the governor's office. And increasingly, it looks like as well coming from the incoming federal administration. So it seems like there's going to be a pretty substantial investment made from multiple sources, including folks in the private sector who are starting to do more partnering with telecommunications, telecommunication companies, and some foundations are doing more work to support broadband distribution across the country, because they're recognizing that it's not a private benefit, it's a critical infrastructure piece for pretty much everything, at least in this era.
What would you like to see happen in the community to address access to affordable transportation? Is there anything that you, with your experience in your sector, can share your thoughts on? What can we pay attention to?
One of the things we do at the Transportation Council, we're a planning organization, is we've developed a bicycle master plan for, it doesn't cover the whole region, but Wenatchee and East Wenatchee. And a big reason we've done that work is because we think that, we tend to think of cycling as recreation, but if we can get to the point where most neighborhoods are connected to the loop trail and connected to job centers and services, just to give more people that choice. There's plenty of other communities who have made that investment and have shown that if there are safe, comfortable, enjoyable bicycling routes that allow people to get to work, school, etc., a lot of people will make that choice, and that's a really important economic choice for a lot of households. If you're young, if you're trying to get on the first rung of the employment and economic ladder, if you can defer owning a car for 5 more years, save for the down payment, save up for the rent deposit, that's all tied together. So, I hope to see our bike plan put on the ground here in the Valley. I think it could help a lot of people.
And our public transportation is bike friendly. So if you do live in an area that is not accessible to link transit, you can ride your bus, put your bicycle on the bus and get to where you need to go. But yeah, I agree with Jeff. I think that bicycling is underappreciated because we do have access and great trail here in Wenatchee. But yeah, great idea, Jeff.
Well, and to Karen's point earlier, let's make it more regional too, so you are a little safer riding to Leavenworth from Wenatchee. and we mentioned it earlier, but I think that the safe pathways as well, sidewalks, enhancing those safe pathways is important.
Yeah, and I think it's also important just our communication with the communities. Do they really understand these options with Link or with the bike bed trails, that are out there and available to them? Do they have an idea of some of these options? So how can we communicate better with them, and not just communicate about these options, but get input from them? We really need a sidewalk here. This trail here could really help. A Link bus stop here. I would ride the bus if there was a shelter right here. So what can we do to engage the community? I think that's one of the most important parts, especially some disadvantaged communities that we've touched on today. How can we better reach them? So not only doing the projects, but just more important, communicate with those groups so we can plan for the future.
And I hope we'll see some kind of private innovations in making access to individual transportation a little bit more accessible, affordable, and needs-based. So back when I lived in a larger city, which I do not miss, so do not take this that way, but I was part of a car sharing organization where I didn't need to own a car, but every once in a while when I knew I wanted a car for the day, I could do so. And because I paid a really modest monthly fee, it actually worked out to be cheaper for me to be part of that car sharing group than it was to rent a car for the weekend or something like that. So seeing some creative innovations like that brought to the Valley and to the broader region would be really quite lovely, I think.
So we have in the past had a Vanpool program similar to what you're speaking to, Karen, and have had discussions in going forward, working closer with large employers to create that sort of a resource for people that are interested. And so that is kind of on a part of our bucket list for the future. We were successful with receiving a sales tax increase and had a plan that has gotten changed a bit due to the COVID, but that's part of hopes in that plan for the future, just depending on how we get out of where we're at right now.
That's really good news. And some models also like the company Zipcar, so that if one day I need a truck, I can get a truck. One day I need a van, I can get a van. It'll be exciting to see about how these innovations work out. I know with the state, we don't have, well, we just closed a funding round for the electrification of transportation systems. And obviously the state is really pushing some support for electrified vehicles across the region or across the state. That can contribute to better air quality and fewer fossil fuel use, obviously. And so it'll be interesting to see how the transportation affordability considerations factor in alternative energy as well, so that they're not having to be at loggerheads. Not that they are now. I know that Link has already invested in some amazing clean fuel buses. So.
Is there, I think we've run through my questions. Is there anything that I didn't ask that you want to make sure that we address? Maybe something that you get questions about from the public routinely and you want to make sure that our audience today hears, or maybe there's something that you're working on that, as soon as things turn around here, we'll be able to happen to help in this area, or just final thoughts.
Maggie, do you want to talk about the volunteer?
Sure.
I'll just put you right on the spot.
Okay. It's not the first time, but
I know.
No.
Sorry.
No problem. We, the board of directors here at Link Transit actually passed funding to look at a volunteer driver program. And we'll be doing that this year. We don't know exactly what that's going to look like. It will cover our public service area, Chelan and most of Douglas County. there may be some criteria attached to that. I don't have any detailed information, but that might allow for those pocketed areas that are isolated or don't have service to at least have something transportation-wise to be able to use to get people into Confluence, which is kind of that medical hub or wherever they need to go. And I'm thinking specific areas like, Plain and Lake Wenatchee and those types of remote areas. We're hoping that will help solve that problem, but it'll be a while, I think, before the program's implemented, but it is something that we have been approved to move forward with. So I'm excited about that.
Well, we have some upcoming projects that I briefly referred to earlier, but just to clarify, I'm with the State Department of Transportation. So while we don't have city streets or county roads, we have the highways mainly between communities, but we also take care of the highways through communities. So SR 285 North Wenatchee Avenue, there will be an upcoming project there that will have the opportunity to add bike, pedestrian, and transit facilities in that area, in the Walmart area, kind of that way. And then on the SR 28 corridor in East Wenatchee, where it's just 2 lanes right now, that roadway will be expanded. But along with that expansion of the highway, there will be bike lanes and sidewalks there. And I'm really excited about the sidewalk part, just because if you can picture that route, there's no sidewalks along there for people at all right now. So that'll give access. There's schools along there just east of that route. So access for kids for schools, and then also potentially school bus stops, Link transit stops. So there will be an opportunity for community input on that. Currently, those projects are scheduled. You'll see construction. It'd be in the 2024 timeframe, but there's a lot of prep work for those projects. So we'll be engaging the communities in some of the different groups we talked about today, and what do you need? So that's a big thing coming for us. But those, again, may be delayed because of finances. So we'll have to see how they progress, or there's a chance they could go on as scheduled. So that's a big thing coming up for the Department of Transportation within our communities here.
I hope I'm not stealing anybody Link's thunder here, but our community did pass a sales tax increase to provide more bus service. And that all hasn't been rolled out and put into service yet, I don't believe. I think over the next year or two, we'll continue to see buses operating later into the evenings, more bus service on weekends. And that's really important for people who may not have a typical daytime shift job. You do shift work. If our restaurants ever get to open back up, if you work, wait tables or bartend, taking a longer term view, a post-COVID view, that's going to bring more access, I think, significantly to transportation in our valley.
I think I'm just going to sneak in here too, because we have a good partnership with Link here at the museum, especially this week, because it's our annual Martin Luther King Jr. Multicultural Fest. And Link has partnered on some of our events like today. And they are open for the first time on Monday, this coming Monday, for Dr. Martin Luther King Jr. Holiday day. They have not been operating buses on that holiday for many years, and this year they will be open with a full schedule, as I understand it. So you can talk about it more, Lynn, if you want, but I just wanted to say, like, that's a message that we want to make sure that the community knows. This coming Monday, on a day that they normally wouldn't have been operating, they're going to be operating.
Yeah, we have negotiated in our contract with our Teamsters union to provide 3 additional service days, which we were non-service days in the past. And so Martin Luther King Day is our very first one. So we're excited about that. We'll also be open on President's Day and Veterans Day this year.
Right. I didn't want to close out if someone has anything else to say, so I'm just going to put it out there one more time. All right. Well, it looks. Oh,
I just wanted to say thanks for bringing the topic out. I think it's an important conversation. Appreciate it.
Yeah. I just wanted to thank you all for joining us for the Social Justice Community Forum series. It is a series, so if you have a topic you would like us to add to our series on social justice, please send us your suggestions through our comments or chats, or you can email us at info@wvmcc.org. And WVMCC is Wenatchee Valley Museum and Cultural Center's initials. So if you remember that, just give us an email and we'll look into some more topics to add to the series. And thank you to all of our panelists for your participation today. I have learned a lot. We talked about things that didn't even occur to me that we would talk about, but it's just such great to hear from all of you and hear what the plans are and just be more aware of and think about it, because I think of transportation, but honestly, I haven't driven my car very much in like, I don't know, 10 months maybe. It's been a while. So I don't even currently think about transportation at all, but I've learned a lot, and thank you for the audience for participating today. And we will have recordings of this conversation online shortly after this, maybe by the end of today or tomorrow. But we hope you'll be able to join us again as we continue this conversation, because there's a lot more topics in social justice that we'll be covering, but it sounds like there's a lot about transportation that we didn't cover. As we were sitting here, I was thinking school buses, that was another, and they have a whole different issue right now, I know, because of transporting more kids because of the virus at different times. So less people on a bus at a time, but then that means they need more buses. Like Link has had to increase the number of buses running. So that hadn't occurred to me before. And I'm sure there's lots more conversations we could have around this topic going forward. So thank you everyone for joining us. And yeah.
Thank you. Thanks for having us. Thanks. And nice to meet everybody too.
Yeah, thank you.
Thank you.
Yes, thanks for the opportunity.
Thank you.